Our approach is innovative because we are combining different things that are not normally combined in health workforce planning. We look into the future using horizon scanning, which some people do. We create scenarios for the future, but they're not always combined with horizon scanning. And then we take those scenarios and model them, which again, people don't often do. They do modeling without scenarios, and we analyze the policies. We think about the future and uncertainty. A lot of people try and ignore uncertainty, hoping it will go away, but unfortunately it doesn't.
In England, we've developed these methods, learning from other fields, to apply them within human resources for health, also in social care and other workforces in our country, but also working across Europe as part of the European Joint Action in Hungary, in the Netherlands, in Germany, to think about common challenges around workforce mobility, and then also working with the WHO internationally and the World Bank. We worked with and applied these methods and transferred some of the skills to use these methods to the Ebola countries, as well as different nations such as Ghana, and with American colleagues as well, in sharing ideas, for example, in Brazil too.
They've improved it because we don't try and forecast like we used to do. We think about the different directions the future might evolve, and we can come up with decisions for workforces that actually make sense. For example, when we did some work on dentistry, the first time we modelled it, we couldn't tell people what policy was best because it was so uncertain. They didn't have any data, so we had to go away and do it again. When we did work on pharmacists, we found that in all the futures there were too many pharmacists, so they had to come up with a strategy to reduce those numbers. So in lots of ways we've shifted between trying to come up with one perfect answer to thinking about which answer's best depending on what might happen in the future.
These methods are a collection of methods from different fields, and we feel they add value by enhancing and broadening thinking about the different pressures in terms of workforce planning. So this also allows us to talk about topics that are very relevant and interesting to very senior workforce colleagues, or for ministers of health, for example, but also with the professions. So we find in our experience this wider debate about the problems we collectively face and the solutions require that stakeholder involvement.